Hey, hi, it's Dr. Kathy, and I am going to talk about the sex problem and solution number 6, which is female and male ejaculation. Okay, so female ejaculation and the male ejaculation. This time I'm going to go male ejaculation first, and then we'll talk about the female ejaculation because I think it'll be a little bit more comprehensive. All right, the male ejaculation. What is it? Okay. It is a discharge of semen or ejaculate, which has sperm, from the penis and results in an orgasm, right? That's the major aim, to have that discharge and end up having that orgasm, right? And that is where you're going to end up, either having that enjoyment, that stimulation, and that pleasure, or you're going to conceive, right? That's the game plan with the guys when they ejaculate. What types of ejaculation do we have? We have nocturnal, right? Emission, which is wet dreams, right? So you do that just spontaneously on your own. We have prostate disease ejaculation. Yes, I know. Some people don't realize it, but when you have prostate disease, you can suddenly have these ejaculations that actually are a reflection of the prostate having an issue, okay? So that has to be checked out by your doctor. There is premature ejaculation, when it's a little bit too early, right? We know that it should be between 5 to 10 minutes, right? Normally when you are able to have penetrative sex, you should be able to last for about 5 to 10 minutes on average, right? Anything earlier, anything sooner can be a little bit too soon. And even for your partner, depending on the couple, it can be a little bit too early, even if it's 10 minutes, right? So you have to discuss it with your partner and see what makes her, comfortable and makes her happy. But on average, anything that's too fast, 2-3 minutes, that's a little bit, early. So that's called premature ejaculation. There is retrograde ejaculation, where the ejaculation goes back into the bladder, right? We don't want that, really. But sometimes people do that to stop having the discharge go into the woman in case she gets pregnant, right? So people do that sometimes, or they want to just prolong the enjoyment by stopping the orgasm or stopping the ejaculation. Then it does go back and gets absorbed into the bladder. There is dysejaculation, where you actually have pain and discomfort. So there are some people that have, some guys that after they actually ejaculate, they actually have pain for at least a week, right? So then that orgasm is called post-orgasmic illness syndrome, POIS, right? Where you can actually have pain for a week, and that's not, something they enjoy at all. So that has to be checked out by your doctor also. Okay. There is anejaculation, no ejaculation at all. Okay. So remember, even though you want to ejaculate, sometimes you can actually not ejaculate. Okay. And you can have an erection and not ejaculate. So not every erection ends up with an ejaculation, right? And not every ejaculation needs an erection. Isn't that interesting? Not every ejaculation needs an erection. So you might just think, okay, I'm going to be aroused, ejaculate, have that orgasm, ejaculate. But sometimes you can get that orgasm without ejaculation, right? And sometimes you can actually ejaculate, like in the prostate disease, and you not really have that orgasm. So just remember that. It's sort of contradictory, but it does happen. All right, so there is also delayed ejaculation, where you can just stay and not, you'll be wondering how many minutes are going by. Some people say 20 minutes, 30 minutes, an hour. It's just too long, right? So that is something that you have to look into to find out why that's happening. Again, ED is one of the common reasons, erectile dysfunction. So you can actually have that orgasm without ejaculation. It's called a dry orgasm. Okay, a dry orgasm. And when you are going through the throes of sex, you want to have that stimulation. So the stimulation is key for guys, right? So you have the stimulation, right? And that stimulation is, we've talked about it before, trying to arouse by, using all the senses, right? Pre sex or foreplay, right? The important thing to note, though, is that during that foreplay, you can actually have non-penetrative sex. So there's non-penetrative sex and there is penetrative sex. Let's talk about that a little bit. So penetrative sex, we know, is penetration into the mouth, oral, the vagina, or the anal. Okay? So that's penetrative sex. Then we have non-penetrative sex, right? Non-penetrative sex includes, when they say outer course versus intercourse, intercourse is penetrative, outer course is not penetrative. So there's no sexual penetration, and it does not involve the vagina, the anus, or the mouth, the oral. Okay, so that non-penetrative sex is other things. I'm going to give you some examples. We have the frottage or frottage, right? And that is where people actually rub their penis, their genitals along clothes, right? And they get aroused with that. That is some sort of pre-orgasm or sexual act that can actually be part of the sexual act and make you have that ejaculation also. There's manual sex, right? That's masturbation. There is mutual masturbation, where two of you masturbate together and there's no penetration. There's kissing, the deep French kissing, and that can actually turn you on. And again, some people will be aroused to the point of ejaculation, and this again can be done for some people that are very, very sensual and sexual. Cuddling, okay, cuddling can again be a form of sex, and sometimes can again allow people to be extremely satisfied, right, just by cuddling. Tribbing, right, that's where women, lesbians, actually women on women, they put their vulva, their clitoris together, and they actually rub it, and they're not penetrating, right? They're actually just stimulating without penetration. Nipples, if you touch and stimulate your nipples, and you are aroused, again, that is non-penetrative. Okay, a sensual massage. Okay, feet, ears, thighs, breasts, right? Even the buttocks. You use those organs that's non-penetrative. Why do I talk about that? Because there's a difference. Okay, there are so many ways of getting aroused, and that arousal is going to make your orgasm more intense and give you the benefits of the health benefits. Now remember, the major benefit of men that ejaculate, the more you ejaculate, studies show, the more you're reducing your chances of prostate cancer. I'm serious. So anyone that has prostate cancer in the family, I'm going to encourage you safely, wisely, privately, in your agenda, put it on your agenda to ejaculate. I always say at least 2 times a week. But the more you ejaculate, it seems to somehow cleanse the prostate. Studies show that. Okay, again, you can find some that are not confirming that, but most studies do confirm that you actually do prevent cancer, prostate cancer. There's studies that show that, especially if you're between 20 and 50 years old. Okay. Now, why do people indulge in non-penetrative sex? Birth control. We don't sometimes want to get the person pregnant, so they don't want to partake in ejaculating into the vagina where she can get pregnant, right? And again, this is heterosexual relationships. Virginity, to keep the person a virgin, right? They'll do non-penetrative sex. Again, this is all sex, which is why that definition of sex has to be redefined. It is just so much bigger and wider now, right, than back in the old days. So to keep the virginity of the woman, you don't want to do penetrative sex. So you don't want to do penetrative sex, you want to do non-penetrative sex. And then also, some people believe that's safe sex, okay? So you don't want to get an STD. So instead, you're going to just do other things, like we mentioned, to not include the penetration. But remember, you can get STDs with non-penetrative sex, okay? you can actually get STDs. And those STDs include HIV, herpes, scabies, lice, okay? Because the contact with the fluid itself is enough for you to get it either on your body or on your skin or on the genitals. So you got to be very careful, all right? So don't think that safe sex is complete. There's still some diseases you can get. So those diseases, you have to be careful about those, okay? All right, so going back to that stimulation. So you really want to stimulate and get aroused, guys, right? So that's the game plan. And when you do get aroused, you're going to get that erection, right? And after erection, you're going to get that pre-ejaculation. Some people call it the pre-cum. And that pre-ejaculation, be careful, can have sperm and can have disease in it. So be careful. Don't think if you're penetrating someone, again, penetrative sex, and you are having some pre-cum, don't think you can withdraw and they can't get pregnant or you can't give them disease. You can. So just take note. Wear a condom, wear a condom, wear a condom. This is all between consensual adults. And just know that your pre-cum can sometimes have sperm and may not have sperm. So sometimes it has sperm depending on the situation. So just know it might have some sperm there. Then from that pre-cum, you go into that orgasm. From that orgasm, you go to the ejaculation. So the orgasm generally comes with the ejaculation or after the ejaculation. And like I said, sometimes you can orgasm without ejaculating. So the most nice thing about this is that you're going to still enjoy the benefits of an orgasm, even if you don't ejaculate. But I know you want to ejaculate, so we can talk about it later as to why people don't ejaculate. But most of the reasons is from the prostate, right? And then of course, other issues can arise that make you not ejaculate. Okay, so I like to use those steps to make sure that you understand, and women and men understand, that the ejaculation has to sort of go through those steps: the stimulation, the arousal, the erection, the orgasm, and the ejaculation. So these are normal physiological processes that go on, right, when you're aroused sexually. Okay, there is a refractive period after you do have that ejaculation, about 15 minutes, where most people cannot ejaculate again. And then there are people that are multi-orgasmic, some men that are multi-orgasmic and don't even go down. They don't go flaccid. They actually stay firm, stay erect, and continue to ejaculate. Now remember, during that ejaculation, there is that contraction, right? That's the key. Muscular contraction, and the prostate contracts. All that happens to aid the ejaculation. So that is what happens. Everything's contracting. Your body's contracting during that orgasm, and you can ejaculate on the first contraction. You can ejaculate on the second contraction. Internally, you might feel the ejaculation, the pulsating of the penis, because the penile muscles also contract, and they also will aid with ejaculation. So all those organs, the bladder, the prostate, the pelvic floor, the penis, they're all, the anal also muscle, they're all contracting to aid with your ejaculation, which is the more involved they are, the bigger the orgasm, right? The satisfaction, the pleasure. Okay. The nice thing about ejaculation is that for guys, it's easy. For the male ejaculation, it's when I say easy, it's more because you're shaped outwards. It's easier to see because your penis is big and it has the sensitive areas, the frenulum, right there, the glands right there. So when you go to the female ejaculate, it's a little bit more complicated. So let's talk about the female ejaculation. So the female ejaculation is an expulsion of fluid from the Skene's gland. Remember the Skene's gland? That's part of the G spot in women. And it's just, from the Skene glands primarily, because people are still wondering if there are other things involved. And I do believe there are other things involved, not just the Skene glands. We have glands and ducts and the rectal sponge and all that involved, okay? But when a woman has that expulsion of fluid from the Skene's glands, they do have that orgasm, right? It could happen again, like with men, during the orgasm or just before the orgasm. Okay, so just before the orgasm, they could expel that fluid, and then that's called that ejaculation. Now here's the confusion: is it urine? Right? People always want to know, Dr. Kathy. They ask me, Dr. Kathy, is this urine? Is this okay? Because some people have been, for years, for centuries, scared of the female ejaculation because they think it's abnormal. They do not believe it's proper. They don't think it's good. They think people that have female ejaculation are not well. They used to have all sorts of names for people that ejaculated. But as time went on, we realized that it is okay and it is actually normal. And when I say that, not every woman ejaculates, right? Some do, some don't. Which is why some people believe in the female ejaculation and some people do not. Now, remember, there's female ejaculation, there's squirting, right? And there's coital incontinence. Coital incontinence is actually urine. Okay, so when you have urine, just urine coming out, which we see sometimes on porn movies, right? It's just urine, and you can actually test and see that that's urine. Okay, and they'll even do ultrasounds and they'll see the bladder, emptying, and so that's urine. And so some people don't even believe in the female ejaculate, but there is something called the female ejaculate, especially when you find that G spot, y'all. Okay, but it's a little bit more complicated than that because I know women are always complicated and we always have to have so many things happen to us before we can let go of our worries and then focus on the moment, right? So you do need to know, guys and gals, that the female ejaculation, they like to differentiate it from squirting or gushing, right? So the gushing is more of fluid coming from the bladder, but there probably could be some female ejaculation involved in that. That's still controversial, right? They've actually done some studies where they put methylene blue, had some of the patients drink methylene blue, and methylene blue goes into the bladder and it stains the bladder urine blue. So they did a study whereby the methylene blue was consumed, and when she ejaculated, they all expected to see the blue color in the ejaculation, and it was not there. Okay, so that was proof in one of the studies that they did that ejaculation does exist, because if there was blue in that ejaculation, which was the bladder, then they would say it was bladder fluid, but there was none. Okay, so just keep in mind, it's very hard to know the difference. Because just like with guys, right, the urethra is involved with for men in the male ejaculation, and same thing with the female. Remember that urethra, the clitoris, the vagina, that Skene's gland, they're all involved in that area of the G spot. So that has to be stimulated, just like the male G spot or the P spot I call. We with the G spot, that all has to be awakened so that you can get her to ejaculate. Okay. So I remember reading de Graaf. He described some white membranous material surrounding the urethra, right? And he calls that the female prostate. So the female prostate, we talked about it before, is going to do the same thing as the male prostate, store fluids and then release it when it's time during the orgasm. So that release of fluid in women and the release of fluid in men, it's the same thing from the same organ, the female prostate and the male prostate, right? But of course, different sizes and different amounts. Yeah. So the men that do ejaculate, you have different amounts of fluid, up to 10 cc's, up to 15 cc's, a teaspoon, a tablespoon of fluid, all depends on how many times that men ejaculate and how young they are and certain diseases. So you can ejaculate certain amounts, not a big deal. But some guys like to compete and want to see how far they can ejaculate, guys. Not a big deal. Again, the most important thing is to have a healthy, enjoyable relationship with your partner and be satisfied, right? Women, we have certain amounts of ejaculate that also come out. You see it sometimes a lot, a little bit. Floors are wet, bed sheets are wet. Again, is this true female ejaculation, which remember is coming from the Skene glands. Now, they described that back in the day as white, sort of thick, right? Creamy. Then they describe the squirting as clearer, right? So the squirting has more urinary fluid in it. Meanwhile, the female ejaculate has less. And they've studied it and they see that the female ejaculate and the male ejaculate have almost similar materials, right? I'm not going to go into the chemistry, but they have things like PAP and PSA and protein and glucose and fructose. And these things really do make a difference in terms of, knowing whether this is coming from the female Skene's gland or not, or coming from the bladder. So if you have these things, the PAP, the PSA, the urea, the creatinine, this stuff can tell you, oh dear, it might be something different from the bladder, because the bladder doesn't have that stuff. It might have a little bit, but not as much as in the female ejaculate. So studies now show, I'm letting you know, studies show that yes, it is separate from the urine. Okay? And the amount in women varies again. So some women will have a lot of fluid, some will not. And the reason why some studies say is because the uterus, right? The ovaries, the kidneys, all of that, they're all around. So they start to ooze and generate fluid production, and they all go to the Skene's gland. That's what they say again. Studies say that all these fluids get generated, which is why some women can actually produce a lot of fluid, right? And that fluid has been tested and is separate from the squirting, which is a little bit of more urine. Okay. Now, if someone is not sure, please go and get checked out. Your urologist or GYN urology can actually help you with that. But if you're having discomfort, pain with urination and frequency, it means that you're having what we call coital incontinence, which is called CI. And so that needs to be treated. Okay, because you don't want to walk around, because it'll get worse with time. But at the same time, there's nothing to be ashamed of, because it might not be coital incontinence. It might just be a natural squirting or female ejaculate that is a little bit more combined or less combined. It all depends on the person. But no matter what, the issue is the more you have that ejaculation, the more the pleasure, just like with guys. So women do want to ejaculate, those that are interested, right? There are some women that do not want to ejaculate. I have even had men say, Dr. Kathy, I do not want my women ejaculating. It's messy. I'm like, okay, to each their own, right? To each their own. I want to make one point also. We know that in men, they ejaculate for, again, procreation and for pleasure. Women, we know it's for pleasure, but is that it? Right now, we talked about that in a previous topic, but again, I do believe that it is also a sign of finding your mate, and to make it simple. So, when I listen to my previous talk, go ahead and go back and listen to my previous talk. It was really interesting. So, the lubrication component of it also is a question, because some studies say that, oh, it's just for lubrication. That's why they ejaculate. But other studies say, no, that doesn't make sense. That if it was going to be for lubrication, it should happen before the orgasm. I'm like during pre-orgasm, during foreplay, all that fluid should be coming up before to make the area moist and lubricated. But it happens towards the end, at the release of orgasm, right? At the end of orgasm, right? So that orgasm is what allows you to enjoy the ejaculation, right? So all that contraction occurs, and the longer it lasts longer in women than men, right? So men, you guys come down faster than women generally, but you'll find that that ejaculation occurs towards the end, not the beginning. So they say it is not for lubrication. Okay. So the question now is, with men, how do we get them to ejaculate? What do you know? You stimulate them, you arouse them, they get the erection, they get the orgasm, and they ejaculate. With women, a little bit more difficult, right? You're going to try and stimulate, try and find that G spot, and yet still, some women will not ejaculate. Some women have never ejaculated, right? So some people will never ejaculate, but we do know that people have been, like I talked before about, have actually learned how to ejaculate, or how to teach women how to ejaculate. And women can teach themselves and go for classes now. So now there's no taboo. You can go around and ask to be taught by different women that specialize in teaching women how to ejaculate, or men that teach women how to ejaculate. And these are actually trainers, right? But, we know what the yoni trainers, right? But I wanted to mention something that some people don't know about, and it's called the Kunyaza sexual technique. Some of you might have heard about it. Kunyaza technical, Kunyaza sexual technique, which is to urinate. All right, that's the name. From East Africa, okay? East and Central Africa, Rwanda. They actually have a practice where they actually teach their men how to make their women ejaculate. Okay, so go and do some research. It's called Kunyanza, Kunyaza. And the method they use, they say it almost guarantees, I won't say 100%, it almost guarantees your partner to have a female ejaculation. Okay, in Uganda, they have it also, and it's called Kachabali. It's the same thing, but they call that spraying the wall. Okay, now to urinate, which is the kunyaza, it's not saying to urinate like regular urine, because there's another name for the urine in East Africa. This is actually just saying that it's like it, because remember, it comes from the urethra, but it's the female ejaculate. So if you do some research, it's out there. There are studies that have been done. There are books that have been written about this kunyaza. It's a technique that y'all can learn and help your mate reach that female ejaculation status that she might want to do. And then again, she might not want to do. So you got to double check, right? So I'm going to encourage you to talk to your partner, see whether they're having that ejaculation, whether they're having that satisfying orgasm, because once they do start having orgasms, you'll see that some do not have ejaculations, and that's okay too. But if you want to up the ante, you want to increase their pleasure, I would encourage you to teach and find out how to get them to have that female ejaculation. And again, that's the ultimate game plan. It doesn't have to be all the time, but once in a while, you do spend some time and get her to have that female ejaculation. Now, remember, it does take time. So you're going to want to not do this for everybody. I understand. You just can't do it for everybody. You're going to choose your partners of who you want to do it with, because it does take time. And the method, again, the Kunyaza method is, I think, one of the most beautiful techniques that you can imagine, but not easy, guys. All right. So I'm out right now. I'll see you guys. Probably I'll be out next week, so I'm not going to be talking. I'm going to take a vacation for the 4th. I'll come back the following week and start again. But at least I think that's on a great note we can end about how to make the female ejaculate, and of course, how to keep the male ejaculating. Okay, guys? All right. Nice talking to you. See you the following week.